3/4 and 1/4. No. So I'm going to pass it through again. Flick it out. Yep. Make sure we pull a bit more through there. There we go. Make sure we're roughly even. You don't have to be too worried about it. We have to sort of use each other and get the tension going through the sheet. So we don't have to worry about that too much, because what we're going to do is, this is just to show you how you can get a sling under someone without having to roll them either. So here I've got the outside of the sling facing down. I'll use the leg strap from the other side. I'll pass that through underneath the slide sheet. So if you take that and pull it straight through in a straight line, right straight through in a straight line, keep going, in through the small of the back, keep going until you can find the strap from your side at the top. Right, find the strap. Once you've got the strap, then we can play with it. We can use each other and pull it up underneath the slide sheet. Right, are we all happy with the positioning? Probably. And then one person just takes it, makes that ponytail again, and straight through the small of the back. Get the parcel, pull it out, and so now the person is already on the sling. And so you just pass that, feed that around the limb, and obviously now ready to hook up to the mechanical lifter. And as you know, mechanical lifters again should be a 2-person procedure, but for any mechanical lifter is an industry standard. However, again, you could break that up into the fact that I can put the slide sheet underneath by myself, I can put the sling underneath by myself, and I could technically look after that by myself. We used to, in domiciliary equipment service, we used to dish out mechanical lifters for older people to be looked after at home by single carers. You know, so it's possible and feasible. It's just it became an industry standard because of injuries, and the best way to, I guess, the most common way to reduce the risk of injury where you had staffing was to say, well, 2 staff instead of 1. It prevented people doing things like leaning across and trying to put the loops on the other side of the lifter and things that cause back injury from leaning, and also some awkwardness manoeuvring the mechanical lifter as well. Getting the sling out, so always feeding it back. When you do it, feed it back underneath itself so that it's actually slipping out back underneath the material. That's really important too. And then what I can do here is I can again slip my finger into the loop. I can pass that through, so if you grab that little bit, now stop there, because you're ready to go. Stop there because you need the other one too, right? I'll pass that one through. Got that one there? Yeah. So pull that through a bit. Now I'll come around the other side and I'll show you. So what's happening is we've got the leg piece. So this is the strap this side, right? But we've got the 2 straps, which is one from the leg piece and one from the top on the other side. That will come through a lot, and then when we feel it stopping, you can actually just scissor it underneath the other piece so that it comes out. So there shouldn't be any shearing on the skin or the person. If you do it correctly, it should just fold in and underneath the pre-existing sling that's already underneath the person, right? So they might feel a bit like, you know, a bit of movement and shuffling as it goes underneath. But if you're dragging or you're causing any pull on the person, you know it's not being done correctly. So you need to make sure that the sling folds underneath itself and comes straight out that way. And just showing you then, you can also use the slide sheet as an individual, almost like gloves. So you can actually use that to get underneath and slide legs. You can use it to get underneath around through the non-weight bearing areas of the body. And you get around, and then you can basically do a little bit of a volleyball dig. So you get in, you slide in, and you can see I've just done a successful roll to the side by sliding in the non-weight bearing areas, getting so that I've got that non-friction, and then I just do a little volleyball dig, and while I'm holding the hip on the other side or the trunk, and it basically assists the person to slide through and hit in the position that I want. Okay, you press stop and we can go with the